And I would like to provide into record, I have a copy of the June 28, 2005 Shawn environmental report that was referenced, as well as September 23, 2010 letter to Mr. Bragg from Shawn Environmental, as well as a copy of the annexation agreement with Land and Lakes in the Village of Buffalo Grove.
If you bring those documents forward, I'll enter them into the record as an exhibit. Does that conclude your comments?
Yes, thank you.
Okay, thank you. For the record, I've entered the Shaw letter dated June 28, 2005 into the record. I've also entered in the annexation agreement. I've also entered in a Shaw letter September 23rd, 2010 into the record. Frank is at the microphone, and the next person is Scott Schultes. If you would come forward, Scott Schultes, and take a seat behind the podium, I would appreciate it. Frank, if you'd go ahead and state your name and spell your name for the record.
Okay. Ladies and gentlemen, thank you for the opportunity to speak tonight. My name is Frank Ladonne, L-A-D-O-N-N-E. I am Principal Engineer with Underwriters Laboratories, having 33 years experience. In order to protect the health, safety, and welfare of the citizens of Buffalo Grove and the surrounding communities, I ask that IEPA not certify completion of post-closure care for Land and Lakes Landfill 5 because of the likelihood of future violations. The areas of concern specifically are phenol contamination, groundwater monitoring wells, and effectiveness of the base liner. Phenol contamination. There have been excessive levels of phenol detected on 7 separate occasions over the last 15 years. In each case, follow-up samples were taken from the wells, and in every single case, though the original samples showed elevated levels of phenol, the follow-up samples showed no level whatsoever. Had this happened once, it would have been cause for concern. Having happened on 7 separate occasions strains the limits of credulity. Though the levels detected were below the maximum permissible levels for groundwater, they were, in all cases, an order of magnitude above the maximum permissible levels for drinking water. As you know, there are over 30 private wells and 9 community wells, all within 1 mile of this facility, and none of these wells are routinely tested for phenol. Groundwater monitoring wells. This site currently has only 5 active monitoring wells. 4 of these are located along the eastern boundary and 1 at the northwest corner. The effectiveness of so few monitoring wells so asymmetrically located depends entirely upon having absolutely dependable hydrology data that provides a dependable profile of groundwater flow. Instead, according to a memo to Greg Morris of the Illinois EPA, the site-specific groundwater flow has yet to be determined. Since this is the case, either or preferably both of 2 actions need be taken. Either the site-specific groundwater flow needs to be conclusively determined, and or additional wells symmetrically located around the site periphery need to be established and sampled with acceptable results for a period of time reasonable to establish an acceptable level of groundwater safety confidence. Effectiveness of baseliner. Protection of drinking water drawn from wells in the vicinity is dependent upon the integrity of the construction of the facility liners. The Shore report of April 2005 notes that it does not appear that the base layer was included in the IEPA certification, and no documentation was found to indicate that it was recompacted. I agree with Shaw's recommendation that a more comprehensive leachate analysis be conducted. This would include measurement of leachate buildup on the landfill liner. A comprehensive analysis of leachate composition would in turn lead to a better assessment of potential groundwater impact. The analysis, as recommended by Shaw, would be accomplished by additional borings made for this purpose. Thank you again for the opportunity to provide comments, and I trust that these comments will be seriously considered and the issues raised factored into the final decision regarding completion of post-closure care. I'd like to enter my comments into the record.
Sure. Bring it forward and I will enter. Thank you. Scott, if you'd come forward to the microphone, please, and the Brenda Wise, if you would have a seat behind Scott.
My name is Scott Schultes, spelled S-H-U-L-T-I-S. First off, the EPA has many of these landfills and brownfields have really done a good job on their development, turn them into greenfields again or mixed-use developments or whatever's going to go on. The EPA has since they became into existence, they've done a real good job at that. And I am here as a representative from our Lake County Building Trades, and the mixed-use development that's proposed to go on that site would really be a boom for our economy and our workers. The tax revenue for the state, the county, village of Buffalo Grove would, I'm sure everybody needs it and they need the jobs, and I believe there's a transfer site out there right now, you know, and I mean, I'm sure the people of Buffalo Grove would like to see that be gone and new jobs and new development brought in there. And I guess that's about all I got to talk about. I thank you for your time.
Thank you, Scott. Brenda Weiss, if you would come forward to the podium, and Shawn Collins, if you would have a seat behind Ms. Weiss.
My name is Brenda Weiss, W-E-I-S, 1S. In the early 70s, I became aware of water shortages and contaminated water supply in the community in which I live, which is Lincolnshire, contiguous to Buffalo Grove. And the IEPA had just been formed and became very involved and helped us and put a huge development, which was the Lincolnshire Corporate Center, on critical review for over a year. That meant that the development could not proceed until we had adequate water, which meant Lake Michigan water, in Lincolnshire, and it was tremendously helpful. At that time, there were really very few safeguards in place regarding environmental protection for the public. It was just all starting. I remember reading about illegal dumping on Milwaukee Avenue, right here in Lake County, as trucks carried their waste products through northern Illinois and over the Wisconsin border. Throughout the 80s and 90s, I ferreted one contaminated site after another along East Milwaukee and West Milwaukee within Lincolnshire village limits as the village continued to expand south. There were instances of underground storage tanks that leaked. There was benzene. There were carcinogens in underground water, too numerous to mention. My concern about Land and Lakes site is certainly it's within the area where the groundwater should be much more closely monitored. Currently, the monitoring is only on the eastern periphery with only one well in the northwest corner. There's certainly a clear rationale, given the history of illegal dumping in the Milwaukee corridor, so much of which I don't think has been discovered yet, to insist on much closer monitoring of the phenols and the benzene registering on the site. I hope you'll deny the closure request for the landfill until such time as it has been thoroughly evaluated and cleanup completed to the maximum EPA standards allowable. Thank you.
Thank you, Ms. Weiss. Shawn Collins.
Yes,
come forward.
good evening, Shawn Collins. I'm sorry.
The next person that will be sitting in the chair is Stephen Harris. Stephen Harris, if you would have a seat behind the podium. Thank you. Okay, go ahead.
Thank you. I'm Shawn Collins, C-O-L-L-I-N-S. I'm an environmental lawyer from Naperville. As you emphasized, 15 years is the minimum. This landfill is not entitled to the minimum in my judgment for two of the reasons, and to draw specifically on what Mr. Morris said at the outset of the hearing. At least requirements 2 and 3 fail. These existing groundwater monitoring wells, and there are only 5 of them for this 30-plus acre landfill, do not adequately monitor the groundwater situation. We don't know what direction groundwater flows in. We do know that it changes, but we also know that 75%, 3 of the 4 sides of this landfill, do not monitor groundwater. We've got 4 wells on the east, as you know. We've got none to the north. We've got one up in the little northwest corner, none others to the north, none to the west, and none to the south. So we really don't know. We've got too few wells and too few locations not drilled deep enough and not testing the right things. One of the things we don't, one of the problems with the wells, one of the many problems, is they're not drilled deep enough. The bottom of this landfill is 40 feet. I believe only one of those 5 wells is drilled as deep as 40 feet. Most of them are drilled 35 to 39.5 feet. In many cases, it would be impossible for them to capture any contamination flowing out of a landfill dug that deep. Also, leachate is not tested. You know that leachate is, if you will, it's the DNA of the landfill. We don't know. There's considerable doubt in the record that I've seen about what was actually dumped in this landfill, but we need to know. And we need to know because we need to know what's headed toward the groundwater. You know that leachate is the goop that sits at the bottom of the landfill and looks for a way out, and its way out is the groundwater. What is it there? We don't know because no one has tested, no one has required the testing of the leachate in the landfill. And so in this way, this operator can't possibly show that it's entitled to the minimum requirement that there will be no future violations of this act in the coming years. Also, I would say it is clear this landfill has been leaking chemicals for some years. Going back to 1995, as Frank Ladonne has already said, there had been detections of phenol and other chemicals. And the issue was not so much at what level or how frequently, although the detections have been frequent enough. The issue is it's getting out of the landfill. The repeated detections of phenol, including just earlier this year and late last year, tell you the landfill is leaking. They couldn't, this landfill asking for the minimum care requirement here couldn't possibly demonstrate that there won't be any future violations of the act when its landfill is contaminating the groundwater right now. So I respectfully ask you, I respectfully suggest to you that giving this landfill the minimum, giving it in effect a clean bill of environmental health now is a rush to judgment that is not only unwarranted, but not in the interest of the public health of the people who live in this area. Thank you.
Thank you, Mr. Collins. Steve Harris, if you'd come to the podium, and the person to take the place in the chair is Amanda Kimmel. If you go ahead and state your name, Mr. Harris.
My name is Stephen Harris, Harris. I am an internal medicine specialist in Vernon Hills, here to discuss the dangers of phenol toxicity. I was formerly on staff at Lake Forest Hospital as well as Condell Medical Center, where I was the chairman of the Department of Medicine for 2 years. Medicine is evidence-based. All science is based on fact, as well as phenol toxicity. Symptoms are many, and they include, number one, ingestion of phenol, which may cause abdominal pain, nausea, vomiting, seizures, increased heart rate, renal failure, as well as death. Number two, inhalation, which may cause all of the above, as well as severe lung damage. Number three, eye and skin damage may occur. All of the above may occur with extremely small amounts of phenol, and flushing with water immediately is recommended, as well as skin and eye protection. Children are much more vulnerable due to the change in body weight ratio. Bone marrow suppression as well as anemia may occur. Some medical problems are short-term, others are long-term. We don't know, however, the time length these symptoms may occur. There is no antidote at this time for phenol toxicity. Emergent care is necessary. Rapid decompensation and decontamination and support of the respiratory system as well as the cardiovascular system is crucial. The best strategy for phenol toxication is to prevent this in the first place. Thereby, monitoring of the water supply is crucial. I thank you for your time.
Yeah, did you want to submit that as an exhibit? Sure, I'll gladly admit it. Thank you.